Good morning, good afternoon, good evening, wherever you are joining me from. Welcome to Mentor Series 4. In this series, I shall discuss with you the general strategies to passing your nursing licensing exam. So there are some key strategies that you ought to know to pass your nursing licensing exams. And those strategies, I call them general strategies and specific strategies. There are two main strategies. In this particular episode, I am going to discuss the general strategies. In my subsequent series or episode, I'll discuss the specific strategies. So one may want to ask himself, why do I always fail my nursing exam and licensing exam? You fail the exam because of two primary reasons that literature have been able to identify. That most candidates fail their licensing exam or their exams simply because of one, they have inadequate content review before the exams. You didn't get enough time to review the content of the materials. Like in my last episode, I highlighted the content areas that you are required to learn before you sit for the licensing exam. So if you have not actually reviewed the content of medicine or surgery, you cannot just walk into the exam and say that you want to try your luck. This type of exam requires some bit of preparation, at least some 6 weeks of learning, reviewing the content to get yourself ready and familiarized with the content before you can sit for the nursing licensing exam. And so it's important that if you do want to pass these exams once and for all, you make adequate time to review your content area. Again, the second most important reason why most candidates fail the licensing exam is that they are unable to apply the content that they learned. And so they have what we call application challenges. Many of the time, the questions that are presented to the candidate during the licensing exam or during any nursing exam for that matter is a practical scenario of a client or patient who have come to you as an expert to provide care for that patient. So you are required to think in a manner that a registered nurse is required to think so that you can be able to provide the needed healthcare for that particular patient to minimize any harm to the patient. But many of the time, candidates are unable to translate the theory that they learn to apply in the clinical area. There are instances where some candidates are very good candidates. In fact, they have very good grades from their nursing school, but they are unable to pass the licensing exam. And this boils down to the application challenge, where the candidate is not able to apply the knowledge that he or she have learned from the theory to the practical scenario. And I will demonstrate to you by the end of this session how you can deal with those challenges. One other way to deal with it is that always try to reflect your mind to the clinical setting, the concept that you have learned. Any content you learn, reflect your mind to the clinical setting. That will help you to be able to reflect on how to apply that content. If you are able to do that, then you are on a right path to getting how to apply the content. So if you learn how to do oxygen therapy, for example, try to see how you can actually administer oxygen to a patient, applying those rules. And when you do that, you will be able to, as it were, translate your knowledge to application. And do remember that every single patient or question you are facing is a potential patient. Now the question is, how do you know your problem is with content or your problem is with application? There are 3 steps you can use to find out this. One is to take time test. What do I mean by that? Get a question bank. And like my last episode, I indicated how you can get a question bank. Get a question bank and then try to time yourself and take a test. Say 100 objective questions, and you time yourself to see how you can answer those questions. After that, That will serve as a baseline to evaluating your capacity in preparing towards the exams, and then help you identify your strengths and weaknesses. For questions you are not able to answer, you know the concept where they are originating from. For example, if they ask questions about some medications and you are not able to answer, then it means that your weakness is in pharmacology. If they ask questions about pathology or management you are not able to answer, your weakness is in medicine. If they ask questions about perioperative and you are not able to answer, your weakness is in surgery. So once you go through the test, it will help you to identify your strengths and weaknesses. The second thing you need to do is to review your nursing school transcripts. When you review your nursing school transcript, you will know the courses that you are doing well and the courses that you didn't do well when you were in the nursing school. And that will also help you to identify your strengths and your weaknesses. And therefore, when you are planning for the exam, you know the areas to learn more. Mind you, you are not required to learn everything on the surface of this earth to pass this exam. The exam has some specific areas that you are required to reflect your mind on to be able to pass the exams. And that is what you need to stay focused and review. And that is why I am here to provide that needed mentorship for you to do that. The third important reason, strategy that you need to also do is to be able to identify the area that you poorly perform from your transcript and for that matter, from the self-test that you took. Now, adding all this up, it will be able to help you to now know that I have weakness in medicine, I have weaknesses in mental health or obstetrics or pediatrics. And then you will know how to plan your studies to try to deal with those things. Remember, you are not going to reinvent the wheel. You have gone through nursing school, you've just graduated, you know most of the nursing concepts. Don't go learning concepts that you are very much familiar with, and anytime they ask questions, you can answer them. Rather, you are supposed to do a self-assessment like I'm indicating here, so that it will be able to help you to identify your weaknesses and you build on those weaknesses. That is not to say that concept that you know you will not revise prior to the exam, but you will need lesser time and energy or effort for concept you know than concept you are not familiar with. Now that you know your problem and you know your weakness, so what do you do with it? Now, you have to draw a comprehensive study plan so that you can now go through the area. So if pharmacology is your problem, medicine is your problem, or surgery is your problem, you have a study plan. Like I discussed in my last episode, how to develop a comprehensive study plan. The study plan might have a morning session to review the content area and an evening session to review the questions. Remember to carefully select a study group. You do not want a situation where you have selected your friends to sit and have a study group discussion when you know very well that you and your friends, you don't understand the concept you are sharing among yourselves. This is the time to hunt for information, to try and get people who have the technical know-how to help you to pass these exams. Because you need to fix in your mind that you want to write these exams once and for all. You don't want a situation where you are going and writing the exam on a yearly basis like a ritual. So you may need to also join a standard nursing exam mentorship group. If you are fortunate and your university or your nursing college have put some consultants together to prepare you for the exams, then you are lucky to join such a group where they will guide you. You need guidance because it's a professional exam and you'll be asked questions as if you are already practicing in the field. And that means you need somebody who is already in the field to guide you to be able to see where the applications will be dragged into. If you don't attend such classes and go through these kind of preparations, it may be very challenging, I will not say impossible, for you to pass the exams. So what are some of the key things that you need to note when you are preparing for this exam? I usually tell my students, one of the most important things you need to do when you are preparing for an exam of this nature is to leave your comfort zone so that you can study. You do not want a situation where you are sitting in your bedroom, on your bed, very comfortable, and you are studying, and the next minute you want to lie down and be studying, and the next minute you sleep off. You do not want a situation where you are sitting with your family and you are watching television and you are talking and discussing, and you are holding your book pretending to be studying. The concepts are critical thinking concepts that you reflect to take care of human beings. And therefore, the examiners or the council or any nursing board will want you to demonstrate that capacity before the license is given to you. You do not want a situation where you will go there ill-prepared. Always remember that you must review the content before you do the questions. And when you are reviewing the content, it gives you an understanding of the kind of things they are going to ask you before you now do the questions, so that you avoid the unnecessary intimidation. People just go about reading the questions and they realize that they cannot answer the questions, and then they will be like, so are these the questions they are going to ask me before they give me the license? Can I ever answer these type of questions? So you are putting yourself in an intimidating situation that will create more anxiety in you, and you may find it very challenging to focus and pass the exams. Reason why you must know the content before you attempt looking at the questions when you are trying to do your personal studies. Again, use the right study material and right review material. In the last episode, I recommended Kaplan, I recommended Saunders, I recommended Brunner and Sada, I recommended Simple Nursing. These books are well documented across the globe that every nursing council or college try to use it to train their students. And the nursing council normally will set their questions based on these standard materials. You may want to get your copy for yourself. If you do get a copy, for example, Brunner and Sada, they have a site they will link you to, and you have access to series of questions where you will test your knowledge and build your capacity whilst you prepare for the exam. And these books that I've mentioned, the recommended textbooks I've mentioned, they contain all the major areas that you need to know before you sit for the exam. So you do not have a situation where you're going around searching for the materials to learn at the last minute. One other important thing you must observe when you are preparing for these exams is to minimize your distractors. Your distractors can actually make you not able to pass these exams. So one of the things that I normally tell my candidate is that leave social media for the meantime whilst you're preparing for these exams. You do not want a situation where you are on social media, you're on TikTok, you're on Facebook, you're on WhatsApp, and those things normally will distract you when messages are coming through your phone. And as well, decide that you will not even buy a bundle unless you want to do any research online to get more information, so that messages, you will not be tempted to go through that. And once you are sitting down studying, you can decide to put your phone far away from you so that you are not tempted to touch your phone to do that. You can deactivate your social media handles whilst you prepare for the exam, because trust me, you need the needed concentration and time to prepare for this exam. Again, remain healthy. Avoid the stress. There are candidates who are doing two types of jobs, and yet they go to school and they want to maintain this job and still go to school or prepare for the exams. When you put yourself through these rudiments of stress, it is difficult for you to concentrate and actually prepare for the exam. You may want to consider, planning your time properly so that you remain healthy, eat very healthy diet so that you can prepare adequately for the exams. Again, I normally say that don't do your personal studies more than 6 hours in 24 hours. You may want to wake up, early hours of the morning, like 4 a.m., like 3 a.m., and you do your own personal studies. 3 hours is enough. Then if you have a preparatory group, like I said, a standard nursing mentorship where they can guide you to do the exam, you go for the classes in the daytime. And the evening, you also do your personal review again. If you don't have that and you have a study group, then you engage your study group to do the discussion. Then later in the evening, you can do another 3 hours for personal learning. But don't go and sit down for 6 solid hours that you want to learn alone. You will crash and you will get into a lot of stress that will not allow you to pass the exams. Whilst going through the content and reviewing the questions, one thing you must keep at the back of your mind is that review the rationale after taking the questions. Don't do them at the same time. So you read the question, you time yourself. I usually tell my student that the licensing authority will give you 60 seconds, which is 1 minute to answer one question. But when you are preparing for the exam, give yourself 30 seconds per question, maximum 15 seconds, 45 seconds, so that you have a regular room of 15 seconds that you can use to, go through your answers before you do the final submission. So when you are reviewing the questions, try to go through the questions. If there are 50 questions, go through all the 50 questions, submit, and then the system that you are using, that particular study material will give you the answers. Then now you can review your answers with the rationale to go through it. But don't answer one question, go and look at the rationale, answer the second question, look at the rationale. It will not let you do comprehensive learning. And so you are measuring yourself, you are testing your speed whilst you are going through the question. Then you go back and also read to get the content areas, highlight the areas where your weaknesses are, the questions you are not able to answer. Then your next review, you go back and learn those particular areas so that it will be able to help you. Use a notepad to summarize the concept that you are learning. You don't want a situation where you are just sitting down and reading like you are reading a newspaper. You will have to write down the specific material. I usually tell my candidates that the exam is about specific knowledge. It is not about general knowledge. So they are going to ask you questions that any ordinary person out there will not be able to answer the question. Even some of the questions, some members of the health team cannot answer the questions except you are a registered nurse. And that's why you must pay particular attention to some of the concepts so that you will understand and know how to deal with it. Again, try to avoid information overload. What do I mean by that? Some candidates try to hunt for information. So they collect this book, they collect this material, they collect these questions, they collect these questions, and now they have a branch of questions or materials, study materials around them, and they don't know which one they are now going to even concentrate on. So the 4 recommended books I mentioned, it doesn't mean you must necessarily buy all the 4 recommended books. If you buy all the 4 recommended books, you may end up being swamped with information, and you will find it difficult to know which one you are going to actually use for the exam. So it is important for you to pay particular attention to these strategies. Come with me whilst I try to give you some sample questions on how to, navigate through these principles or these strategies. So I have a question here, and I'll pose a question and give you some time to reflect over it, give you the answers and see which one you will choose. Then I will tell you the correct answer and the rationale. So this one says, a 40-year-old patient admitted with alcoholic cirrhosis is scheduled for discharge. You have been assigned by the head nurse to provide education regarding diet. What is the most appropriate dietary plan for this patient? Now, reflect over the question. Now, the answers. High sodium, low protein, high calorie. Low sodium, high protein, high calorie. Low protein, low sodium, high calorie. High sodium, high calorie, high protein. So for this question, I always tell my students that every question have the required information embedded in the question for you to answer the question. The question is talking about a patient who have liver cirrhosis. The patient has been treated and is going to be discharged. We are going to give the patient education that the kind of food that the patient should be eating, dietary, the kind of food the patient should be eating. Now we know that in liver cirrhosis, there is a fibrosis and hardening of the liver cells. So metabolism is usually affected. Now, the liver is one of the most important organs in the human body that metabolizes substances for us. For example, protein. So the protein that you consume, the liver is trying to metabolize and the byproduct. And the byproduct, the protein, this ammonia is converted to urea for excretion. Now that the liver is diseased and has this condition, there's a challenge for the liver to try to metabolize those substances. So you may need to consider food substances that will reduce the amount of this nitrogenous waste in the patient, because already the patient have that challenge. And when you look through the answers, you realize that low protein diet is very important. Again, the patient with liver cirrhosis will be having a lot of fluid accumulated in the system, which we say ascites or edema. And so when you give more sodium diet to that patient, it will further increase the edema. So you rather want to give a low sodium diet that will reduce the essence of the edema, the complications associated with that. But this patient is very weak and need more energy. So you may need to give more calorie diet for the patient. So if you reflect through the answers, you will see that the answer is C, low sodium, low protein, and high calorie. I hope you got that one correct. Example 2. Mr. Mensah had left lung cancer. He was planned for surgery after treatment failures. The patient is returning from theater to main surgical unit after left pneumonectomy. What is the most appropriate position to nurse this patient? Prone, semifowless, left lateral, right lateral. I'll give you a few minutes, a few seconds to reflect over the question. So here again, the question have all the information you need to answer it. Remember, they said the patient have left lung cancer. Remember that they said the patient have gone through some treatment and it has failed. Remember that the examiner said that they have now planned to do a surgery for the patient and they've even done it. And the name of the surgery is pneumonectomy, which means surgical removal of the lung. And they are talking about the left lung. So the patient has come back from theater. What position will you place the patient? And I normally tell my students, there is a trick we call opposing answers are one of the opposing answers are always right. When you have a situation where two answers are opposing each other in the objectives, pay attention to one of them. The answer will be one of them. The other ones, you can rule them off. So if you look at this, you have prone position, which is completely different from semifowless position, because the opposite of prone position would rather be supine, so it's not fowless. So these two positions are ruled out by using that rule. But you now see left lateral and right lateral. They are all talking about one thing, but one is opposite the other. So the answer certainly will have to be one of them. So the question is, the person have gone through left pneumonectomy, the left side they have operated. Which side will you put the patient? Will you put the patient on the operated side or the non-operated side? Remember that an individual can survive on one lung, even in very complicated situations. So, but because we have operated on the left lung, we don't want a situation where we're putting the patient on the right side because that lung needs to expand for the patient to be alive. The only reason why you may not want to put the patient on the operated side will be that you don't want a situation, you don't want to instigate pain. So, but if you take difficulty to breathe or breathing and pain, difficulty to breathe or breathing takes a priority. So if we are talking about most appropriate, then you have to put the patient on the side that the operation happens so that the unaffected side, which is the right side, the lungs can expand for the patient to breathe. Meaning that for this question, the right answer would be the left lateral position. I hope you got that one right. Example 3. A 66-year-old patient with chronic glomerulonephritis is developing signs of circulatory overload. Which medication will the registered nurse anticipate the physician to order for this patient? Furosemide, digoxin, spironolactone, lisinopril. Now watch closely that in this particular question again, the condition of the patient is clearly stated that he has glomerulonephritis. The age of the patient is indicated that he's an aged person, is 66-year-old, and that the patient is developing complication, circulatory overload. In glomerulonephritis, the patient is not able to filter. There is, thickening of the glomerular basement membrane, and so the patient is not able to filter his blood properly. Waste product and fluid and all that accumulate in the system, and that can create what we call circulatory overload, which now comes as a complication. So where the person has so much fluid on the system, and the heart is not able to pump sufficiently to send sufficient amount of blood into the system. Now, when this is happening in a patient, the physician will be thinking about trying to increase the strength of contractions of the patient's heart whilst decreasing the heart rate, at the same time trying to eliminate the excess fluid. At a glance with this question, you may be thinking of giving furosemide, which is Lasix, to remove the fluid, but it is not appropriate. But if you watch closely, you have a drug there we call digoxin. And this drug increases the strength of contractions of the heart and decreases the heart rate. So, and it also has some diuretic property to deal with the overload of the fluid. The other medication is also a diuretic. Furosemide is a diuretic. Spironolactone is a diuretic, which is a potassium-sparing diuretic. Lisinopril is angiotensin converting enzyme inhibitor. So it may not be appropriate in this context. In another scenario, that drug may be appropriate. But in this particular case where the patient have circulatory overload, the most appropriate condition that can help remove the fluid and deal with the heart to be able to work properly and allow the kidney to function will be digoxin. I hope you got that one right. Another example is here. A 26-year-old pregnant woman in her first trimester was diagnosed of hyperemesis gravidarum. The registered nurse is performing assessment of this patient for metabolic imbalances. What acid-base imbalance will the patient develop? A, metabolic acidosis, compensatory acid-base alkalosis, metabolic alkalosis, respiratory metabolic acidosis. Here again, the question contains all the information that you need. The examiner says the patient is having hyperemesis gravidarum, hyper, excess, emesis, vomiting, gravida, pregnancy. That's excessive vomiting in pregnancy. So the client is vomiting a lot. Now, you have to reflect your mind. The examiner even told you in the question that you are looking for metabolic imbalances. Now, you have to reflect over your mind and ask yourself, go back to your nursing sciences. And one of the basic principles in the nursing sciences is that there are two pathways in the body. We have the respiratory pathway and we have the metabolic pathway. So if you look at the body systems, the only system that deals with respiration is the respiratory system. All other systems is dealing with metabolism. So if the person is vomiting, that is GIT, and therefore it's a metabolic problem. Now, from even primary school or JSS, high school, we're told that the upper GIT contains acid and the lower GIT contains base. So we're told that hydrochloric acid is in the stomach and that the lower GIT contains potassium hydroxide. So right away, you know that upper GIT, the stomach upwards, is about acid and the lower GIT is about base. We know that about 3.5, pH of concentration is there in the upper GIT. So if somebody is vomiting, the person is throwing out the acid and leaving the base, which is in the lower GIT, because you can't vomit from your lower GIT. You are vomiting from the upper GIT. So as you vomit, you are throwing out the what? The acid, and your body will now be made up of more of the base. In that case, your body will be shifting into an alkaline medium, which we call in medicine alkalosis. And because it's a metabolic problem, you are going to develop metabolic alkalosis. The patient will develop metabolic alkalosis. Now, if you apply the other rule I told you earlier, that opposing answers, one of them is always correct. If you look at it, you see metabolic acidosis, metabolic alkalosis. So it tells you that right away, there is nothing compensatory about this question. There is nothing respiratory metabolic acidosis about this question because these are not actually close. So the two ones that are very close is metabolic acidosis and metabolic alkalosis. And you then ask yourself, if someone is vomiting, it throws out acid, and therefore the body is made up of more base, so the body will shift into alkaline medium, so metabolic alkalosis. I hope you got that one correct. So all along, I've been trying to set your thinking, set your mind to the fact that you need to reflect over the content. And I've demonstrated to you that if you don't review the content and you read the question, you can never answer the question. So you need some critical thinking to be able to develop some knowledge, some understanding of the knowledge, develop wisdom, and develop common sense so that you can pick up the answers. And mind you, you are doing this in 60 seconds. So you have to think very fast One of the basic principles we use in the health profession is that it's about speed and accuracy. Speed and accuracy. Yes, you have an array of patients sitting in front of you, which is your responsibility to take care of them. You cannot remain on one patient and then the other patients will die. Your ability to work fast and deal with the problems of all the patients sitting in front of you and yet still do the right thing is what we call speed and accuracy. So thinking fast, developing your speed, reviewing the content, getting the content materials that you need to know, reviewing the questions and building your pace for the exams is the surest way to getting you passing the exams. And I've used these strategies to help several candidates over a decade now, and they have been able to pass their license and they are practicing in various parts of the world. You will be part of the next batch of people who will pass this licensing exam or any nursing exam for that matter with, the first attempt. As usual, I always say, knowing is not enough. You must apply what you are learning. Even when you want to apply, it is not enough. You must be doing it. If you are willing to apply, it's not enough. You must do it. And therefore, we say that all the things we are learning, we should try to practice them because practice makes perfect. When the brain is able to see the things, the eyes is able to see severally, at least 3, 4, 5 times in a day, you are more likely to recall it. But if you don't read, if you don't study to see the content all the time, chances are that you cannot recall them when you sit in front of the computer to answer your questions. I hope this episode will help you put yourself together and prepare for the exam. Thank you. Subscribe to my YouTube channel. In my next episode, I'll be discussing with you the specific strategies to help you pass the licensing exam. I will go behind the scene to tell you the thinking of the examiners, how they set the questions. The questions are set based on certain principles and concepts. I will share those concepts and principles with you so that you understand that this is how the questions are developed and this is what the examiner is asking me and this is the trick I need to use to answer this question. I'll share all those strategies with you. My aim is to provide mentorship without barriers to nurses across the globe. Call me the Nurse Scientist. Subscribe to my YouTube channel and engage your colleagues to do the same whilst we build this together. Thank you.